off, move forward, and to move forward into the next phase of identifying the outline, developing the content, the processes, etc. Having had the pleasure of being involved in this in the last iteration, I have come to really respect how inclusive, transparent, and really leveraging of everyone's expertise. So I cannot say how thrilled I am that all of you are here to join us on this kickoff. I think while we're settling in, we wanted to ask you to feel free to type in your name, your organization, and your role and your pronouns in the chat, if you would. We can't get to know everyone, but we would certainly love to invite you to do that as we move forward. Okay, and as we do that, I think we can move forward. So great. So while everyone's typing in their introductions, here's the agenda for today's kickoff meeting. First, we'll provide a background on the cancer plan, including overview of CDOC and our comprehensive cancer control plan. We'll also update on the progress made on objectives included in our current plan, the 2021 to 2025 state cancer control plan. I think you'll be hopefully pleased, but also see a lot of work still and challenges remain. Next, then we'll cover what is the process for developing our next plan, including what to expect in terms of time commitment and support, how we hope you can get involved with us, etc. Just a few notes before we go forward. The chat is being monitored for questions, so please go ahead and feel free to use that if things come up during the this meeting. Also, the slide deck, the recording, and any follow-up FAQs or others will be sent to all participants. So don't worry, you don't need to be taking notes during this time. Okay, so as you can see in this current slide, in case you don't already know, support for CDOC really originates from the Centers for Disease Control and Prevention, Division of Cancer Prevention and Control. And those funds, I want to say, they're not expansive. They're very limited, but they flow through the California Department of Public Health's Chronic Disease Surveillance and Research Program, then to California's Comprehensive Cancer Control Program, which houses our coalition that we call CDOC. Next slide, please. And specifically, California's Comprehensive Cancer Control Program is charged with actually 3 roles. Number 1, establishing our cancer control coalition called CDOC. 2, assessing the burden of cancer, and I hope many of you caught our latest webinar last month on this. And then 3, developing and implementing, and I want to actually add and tracking the implementation of our comprehensive cancer control plan. I'll now hand things over to our CDOC co-chair, Dr. Allison Herman, for more information about specifically CDOC. Allison?
Thanks, Zora. Okay, so if you're still wondering what is CDOC, as a reminder, so CDOC, California Dialogue on Cancer. So we are a coalition of cancer control leaders and folks who are really concerned with the cancer burden and addressing the cancer burden of residents across the state of California. Next slide. CDOC's mission is to reduce cancer suffering and mortality in California through risk reduction, early detection, improved treatment, and enhanced survivorship. We have 176 member organizations and counting, and approximately 69 highly engaged and active members across our work groups and other projects. Next slide. Priority areas include increasing colorectal cancer screening, increasing HPV vaccination rates, addressing survivorship needs, reducing health disparities, which is an overarching priority across all of these topic areas, and reducing obesity prevalence. Next slide. So here's the leadership team. You met Dr. Tanjasiri already, and myself. We also have Bridget Freely, our vice chair. We're very lucky to have her. Shantae Davis, if you haven't met her yet, you will get to know her very well. She does it all. And then we're very, very lucky to have both Joy Seha and Sheila Senyo to support us in our work as well. Next slide. Here is our org chart. So we have our CDOC executive committee formed of a number of individuals who help provide overarching guidance for all of the CDOC work. And the chair, vice chair, associate chair are all a part of that committee as well. And then you see we have 4 active work groups at this time: colorectal cancer, survivorship, health equity, and lung cancer screening. And then we have liaisons who report to those work groups under each. So we have the American Indian, Alaska Native liaison, the C4 Coalition, California Colorectal Cancer Coalition, HPV vaccination, which is the California HPV Vaccine Roundtable, nutrition and physical activity, and then also tobacco. So as a reminder, Dr. That's okay, you can go to the next slide, that's right. Perfect. So Sora had mentioned, that we are funded by CDC. CDC funds all 50 states, the District of Columbia, Puerto Rico, other jurisdictions to have these comprehensive cancer control plans. So we are funded by CDC. The money funnels down to us through the California Department of Public Health. And our cancer plans for us and for everyone else, we really have a mandate to have cancer plans that identify how organizations, or in our case, a coalition, can address the burden of cancer in their designated geographic region. So for us, the state of California. Plans are specific to the region and based on data. We'll review some of that today, and include strategies that have worked, so evidence-based approaches, and how we're really aiming to make a blueprint for action with our plan. Plans are typically renewed every 5 years, but as you'll hear a little bit more. Sometimes plans are for a longer period of time as well. Okay, great. So thanks. I will pass it back to you, Shante.
All right. Going back to a little bit of the background for our cancer control plans, implementation is the responsibility of all stakeholders in California. So we do have, certain efforts that are led by our program and coalition, where we have prioritized objectives that we may initiate implementation on. And as you heard, we really don't get a lot of money to do this work. So it all depends on what the capacity of our coalition is and really what our stakeholders are able to volunteer. Do we have experts in that area to help us with certain, to implement certain evidence-based interventions? So while, again, we do implement some of those objectives, the cancer control plan is really meant to be sort of a blueprint for the state in reducing cancer control. We are charged with leading the development of the plan, distribution, and coordination of implementation of the plan through CDOC. As I mentioned, we do have those prioritized objectives. But ultimately, statewide cancer control stakeholders and community members are the driving force behind achieving the plan's goals and objectives. Here are our state plans, and I know Sora mentioned in the beginning we're working on the 4th iteration. This is actually our 5th iteration and I can't believe it. I know, Sora, it's been a while. It's about 20 years now to when we first rolled out that first plan, that light blue plan there. When I came on board, my task was revising our very, very first plan. So this is my 4th plan that I've worked on. So you see all of our plans there. And yeah, now we're going to be working on number 5. And I'm going to turn it over to Joyce Sehan. She's going to give us just a brief overview of a progress summary of the current plan that we have with all of our, with the measurable objectives that were the data that we have for those. So go ahead, Joyce.
Thank you so much, Shante. So I'll be providing a high-level overview for the 21-25 Cancer Plan Progress Summary. This report outlines progress made in implementing California's Comprehensive Cancer Control Plan for 21-25, or the State Cancer Plan. The State Cancer Coalition, CDOC, administered by Comprehensive Cancer Control Program under the California Department of Public Health, spearheads the implementation of selected prioritized objectives Notable work facilitated by CDOC in the iteration of the state cancer plan includes working towards standardizing sexual orientation, gender identity data in cancer reporting, increasing colorectal cancer screening, and addressing diversity, equity, and inclusion in clinical trials in partnership with California's NCI designated cancer centers. In addition to collaborations with the American Cancer Society that drives efforts to increase HPV vaccination through the California HPV Vaccination Roundtable, as well as initiated a project to increase cancer screening post-COVID-19 pandemic, which established efforts to increase lung cancer screening in California. So the progress highlighted in this report pertains to measurable objectives with the most recent available data. However, not all objectives are addressed, and some baseline data was obtained from sources no longer collected, preventing a comparison. So this information presented will be made available on the CDPH website in the coming weeks. And I provided a key at the bottom with symbols that indicate different progress that has been made on each objectives. So starting off with the cancer burden in California, we've exceeded the objective 1 in decreasing combined cancer incidence in California. For objective 2, we haven't met the objective for decreasing combined cancer mortality. However, trends are improving for decreasing combined cancer mortality. Overall, for primary prevention of HPV vaccination, you can see that progress still needs to be made. I'd like to point out that trends are improving for reducing geographic disparity gap in HPV vaccination among 13-year-olds, particularly in rural areas. The caution should be utilized when trending CARE 2019 data with CARE 2022 data due to reporting changes. For the obesity measure, objective 1, including increasing the number of pregnant women and women of child-rearing age who limit sugary drink intake and consume recommended servings of fruits and vegetables. You'll notice that the objective 1 progress has exceeded in consuming 2 servings of fruit, while progress still needs to be made with increasing vegetable consumption, limiting sugary beverages, and meeting all 3 recommendations of fruit, vegetable, and sugar consumption. For objective 2, progress was recorded for children and adolescents who report not drinking a sugary beverage and consume the recommended daily servings of fruit and vegetables. Overall, children and adolescents are achieving the federal requirement for daily fruit and vegetable intake, reducing consumption of sugary drinks and meeting all recommendations of fruit, vegetable, and sugar consumption. And then lastly, for objective 3, trendings are improving for increasing the number of children who engage in 1 hour of physical activity at least 5 days a week. So trends are improving for reducing the tobacco product use among high school age and youth ages 18 to 25, and objectives have exceeded in reducing the prevalence of tobacco use among adults covered by Medi-Cal. Transitioning to early detection and screening, trends are improving for increasing the percentage of breast cancer diagnosis. However, still improvement on reducing breast cancer mortality among non-Hispanic Black women, and the data source for objective 2 was not available. For cervical cancer, overall trends are exceeding or improving among non-Hispanic Black, Hispanic API, non-Hispanic white women to decrease the percentage of women who have not received a pap smear within the past 5 years, eliminate the disparity in clinical cancer, cervical cancer incidence, and eliminate the disparity of cervical cancer minority. For objective 3, no change has been made for Hispanic women, and the objective has been met among non-Hispanic white women. For colorectal cancer screening, you'll see the objectives to decrease the late stage diagnosis of colorectal cancer for Medi-Cal or uninsured, increase colorectal cancer screening, and decrease late stage diagnosis of colorectal among ages 40 to 49 have not been met and still needs improvement. Similarly, melanoma progress organized by county has worsening trends. However, some notable counties such as Closa, Glenn, County, trends are improving. For example, Kings County objective has exceeded, and Del Norte Humboldt County has no change. Lastly, prostate cancer trends related to increasing the proportion of men over 45 who have discussed advantages and disadvantages of prostate cancer screening with their provider are worsening. And for objective 2, increased proportion of African American men over 45 who have discussed advantages of prostate cancer testing with their provider are improving, and those that discuss disadvantages still need improvement. As a reminder, this data will be made available to view in its entirety on the CDPH website in the coming weeks. Speaking of data being made available, the CCCP dashboard is now available on the CDPH website. I'll be dropping the link into the chat shortly. And thank you so much. Now that we provided some background context and progress, I'll pass it back to Shantae for some state cancer plan development items.
Great, thank you, Joyce. And if I can just sort of going back to the progress summary for the cancer plan, we do have an actual, document that's going through the approval process now that will be made available. And it looks similar to what Joyce has shared there. But we also, that data you can find right now on our state cancer plan dashboard. So we just got approval for that. And if you go to the dashboard, it's something that we'll be promoting in the new CDOC newsletter, and you can go there and find out the progress for all of those measurable objectives where we have data to see where we're at with the progress there. So there's the link. I know we went through it fast because there's a lot of objectives. So again, if you're interested in that data, go ahead and go to our dashboard. All right, so now I'm going to jump into developing the next state cancer plan, one of the main reasons why we're here. And just a note about data while we're talking about data, the most recent data that we have from the California Cancer Registry is 2020. So that's the data that will be available for all of our content developers that will be helping to develop content. We are expected to have 2021 data sometime in the spring this year. So once that data is available, we'll also, it will be available to those who are helping to develop objectives as well. We also presented just a large overview of the cancer burden in our cancer burden webinar on December 10th. And if you go to our website, I'm going to go into the website a little bit later. You can find the recording there. And there we presented a lot of trends that are happening right now. And we do have some summaries of, the highlights in the trends that's available for everyone as well. And just to note, in developing objectives for the cancer plan, there are other data sources that we use. We primarily use CCR data, but we use BRFIS data, CHIS, California Immunization Registry data, and some other data sources as well. And in our guidance package, for those who will be involved, when we go through our instructional webinar, you'll learn all about assistance with data and things like that. And I also want to just give a shout out to the California Cancer Registry and all of the staff there that helps us get all of this data and work through this. And you'll see later that they are going to be a big support in helping to develop this plan. Next slide, please. And then here is just a little snapshot of the 2020 data that's available. These are the 10 leading causes of cancer incidence and mortality for both sexes combined. And just to note, as we go through the process, the California Cancer Registry is available to pull other types of data for us. Right now, we do have race and ethnicity data available for 2020. for both sexes and sexes combined. That's on our website to inform cancer plan revision. But again, once you get started, you know, you'll be able to work with someone from the California Cancer Registry, or we liaise with them for you on your specific data needs. But again, just wanted to kind of show that the snapshot here, because we do ask folks to kind of look at some of the data as we're getting feedback from you for this plan. The other thing that we do follow in developing our cancer plans, and you know, we are funded by CDC. They are charging us to do this work, so we must align with the National Comprehensive Cancer Control priorities. And so I just want to kind of go over what those are. The first one is emphasizing primary prevention of cancer. And, you know, that can include anything from HPV vaccination to reducing tobacco use, UV exposure, radon, environmental, et cetera. And I also want to note that with all of these topics, CDC does leave it up to states to determine which topic areas should be focused for each one of these priority areas, but we must cover all of them. The second one is promoting early detection and treatment of cancer. So looking at cancer screenings, looking at genetics, things like that. Supporting cancer survivors and caregivers is always an area that we're focusing on. And then we have cross-cutting priorities of building healthy communities through PSE approaches, or policy systems and environmental approaches. So we have resources and encourage those who are developing strategies for us for the particular objectives to ensure that they are PSE related. And then, of course, achieving health equity within cancer prevention and control. So that's sort of, again, that overarching cross-cutting priority for all of the content. And then, of course, demonstrating outcomes through evaluation. So those are all of the National Comprehensive Cancer Control priorities that our work must be aligned with. And in this process, we also look at our CDOC priorities. As Sora went over our current priorities that have been in place for a while, you see them on the left. And through discussion, I mean, we've been talking about cancer plan revision and and a lot of this stuff for months. And just some of the new items that have come up for our priorities are advancing health equity and cancer control as an overarching priority. And we have improving healthy living, although we haven't determined exactly what that's going to be called, but it really does kind of center around nutrition and physical activity. But we also want to ensure that we're addressing, you know, sort of the environment and things like that as well. So improving healthy living is what we'll call it for now, but these are all kind of draft and proposed. We're still kind of working that out. And then increase lung cancer screening. Last year, well, actually starting in 2021, CDOC started to work with the American Cancer Society on some lung cancer screening efforts, and all of that has led to the erection of a lung cancer screening work group for CDOC. So, you know, right now California is, I know we were 1% in cancer screening for the nation. I'm not sure what it is now, because I think that it went down a little bit, or we're on the bottom, let's just say that, for lung cancer screening. So we do need to ramp up our efforts in California. And again, CDOC is, you know, moving along with that in collaboration with the American Cancer Society with our lung cancer screening work group. Other areas to address, and these are just around just discussions that we've had with our executive committee and leadership, but we always include the cancer burden in the cancer plan. Childhood cancer will be included as well. Equitable access to care, cancer-related health disparities, cancer health disparities among California American Indians. I know a lot of folks have seen the data on this, and we are especially looking to focus on that for some of the content. Cancer in the environment, cancer surveillance, cancer centers, and of course, including gender inclusive language. And again, we haven't decided anything on the cancer plan as of yet because we still want to collect your feedback. But again, there has been a lot of discussion amongst leadership and our executive committee on the things that are important and that should remain and be included in the cancer plan that will be considered. All right, so next steps on developing the cancer plan. All right, so here's just a broad overview timeline, and I can go through this pretty quickly, but as I mentioned, we've been talking about this for a while. So back in March of 23 is when we've started these discussions at an executive committee in the spring. We've had our cancer burden webinar, that was November 15th. And now then we worked on developing a cancer plan survey, which is ready to go. And we're gonna ask everyone to complete that after this webinar. We did a little bit of data analysis for the draft outline with our executive committee. And today we're at the cancer plan kickoff webinar. As I said, we'll release the cancer plan survey today as well. And then also recruit our cancer plan advisory committee. We'll also inquire with you all about participation in the process through the survey. And then we're hoping that around mid-February, that we will have the outline for the cancer plan. And then we can determine which subcommittees are going to be needed as we move forward in developing the plan. And then, we'll start recruitment for those subcommittees and any subject matter experts that we need and helping to develop the plan. And then we will have an instructional webinar. And the instructional webinar will really provide guidance on how to go about just developing your objectives and strategies, resources you can use to pull from the PSC objectives and the evidence-based interventions, guidance on the data, how to write a SMART objective, etc. So that cancer plan instructional webinar we're hoping will happen around March. And then from the spring of this year to the spring of next year, that's when all of the subcommittees will be working to develop the content. And so we'll allow around 6 months or so for the plan to go through the CDPH approval process, which is a requirement, and hoping that it will be completed and approved by December of 25 for release in 2026. All right, so as I have mentioned several times, we have a state cancer plan revision survey, and we want your feedback. So please answer our survey. The survey will take probably about 15 minutes or so because we really want you to tell us what you think and to give some feedback on certain items like health equity and things like that. So please complete our survey. We're going to provide an incentive also when we send that out. It will probably be like an Amazon gift card. So there's a little incentive built in there. The cancer plan advisory committee here, the cancer plan advisory committee will provide broad oversight for the overall development of the plan and focus on foundational and special sections of the plan. Right now, we're still kind of working out, the process, the application process, the number of members. But you will be able to indicate your interest in being a part of this cancer plan advisory committee through the survey. The cancer plan subcommittees, they will be responsible for developing specific content or topic areas of the plan. These subcommittees meet regularly to develop their respective sections of the plan. And that's really left up to the individual subcommittee, because you all will be meeting, so it will be based off of your time. We will provide guide or support in having those meetings, but in terms of when you meet, that will be up to your subcommittee. They will be organized once the outline of the plan is determined, because again, we don't know exactly what will be included as of yet, but once we do, then we can release the list of what the subcommittees will be. And we'll announce this through the CDOC listserv, probably in March sometime, and instructions on how to volunteer and all the other information will also be included at that time. So time commitment, if you do participate, what does this look like for your time? Again, it's projected to begin in March of 2024 and go through March of 2025. So it's about a year. The estimated time commitment for each subcommittee, and these are only estimates, the time that you spend will depend on your particular subcommittee and the type of content that you're developing. But 2 to 3 hours a month participating in a video conference, 1 to 2 hours a month working on content of your own, and maybe 30 minutes or so on email communications. So that's just a general estimated overview of the time commitment. And as I've been mentioning, guidance and support, the Comp Cancer team and CDOC team is here to provide administrative support for all of the subcommittees. So we'll be able to provide you with, we can set up your meetings probably through Teams. And, if you need us to help follow up with some folks, or to help remind the chair of the meeting, or whatever those needs may be, we're here to help with every step of the process. And also, as I mentioned, support for data acquisition will also be provided. And just kind of, continuing on with guidance and support, as I mentioned, there will be an instructional webinar. And if you missed this webinar, we record everything, so that will be available. We'll have quarterly check-in meetings. So every quarter, we'll have 4 throughout the time that we're developing this process, but they really are intended to just provide updates on where we're at, where the subcommittees are at, and also for the subcommittees to chat with each other and learn about the types of content that they're putting together. We found, for example, last iteration that some folks from the I think it was the survivorship committee, wanted to chat with the childhood cancer folks at one point, because some of the content that they were developing aligned, for example. So you'll be able to see what other folks are working on and ask questions of other subcommittees. Any other things that may come up, it's a good place in these quarterly check-in meetings. And then, as I mentioned, we have the cancer plan revision package. So you'll also get a large package of documents to help and assist you with this. We guide you and provide support every step of the way, so you're not just left, trying to figure out what you're supposed to do. We have, all of the webinars are recorded, and we provide all of the links to go listen to that information. If you don't want to listen to the whole webinar, that's fine. There's certain documents that we have on the data sources, on writing SMART objectives, on aligning with healthy people, for example. We have all of these documents. It's a huge package. You see screening and recommendations. And although we don't make recommendations in this plan, some of those objectives, you need to reference what the current either USPSTF or American Cancer Society recommendations are for that particular cancer, for example. Yeah, and then of course, information on how to obtain data. And we will have all of this. Can you go back to the other slide, please? We will have all of this on our website. So we're working on a dedicated cancer plan revision page. It's already up because in our cancer plan revision survey that we're going to ask everyone to fill out, there are links that lead to this page to provide information on the cancer plan, on the progress report, on the CCR data that's available. And then it will also serve as a landing page for information and resources once you get started in the process. So all the documents for the guidance package will be on there. All you have to do is click on the website and be able to access, how you find your data sources or your PSC interventions, for example. And there's the link there, so you can go take a look at the state cancer plan revision page. And we'll also post, for example, the upcoming quarterly webinars. If you missed it, here's the recording, etc. All right, so now I'm going to turn it over to our chair or co-chair to wrap us up here.
Thank you, Shantae, and also to Joyce and Allison for that wonderful overview. So you might think that we're kind of do a long ramp up. It's like we're on the runway. We're now all boarding the plane. We're about to take off. So there's a few other things that we can do. I feel like I'm the, buckle your seatbelt, here are the safety precautions. But just to wrap things up, there are a few other ways that you can stay involved as we start to ramp up and take off. First, if you and your colleagues haven't already done so, please join CDOC and get added to the CDOC listserv. You can either click on what will be this link to complete a new member form, or simply just send an email to cdocshare@gmail.com, and you'll get added to stay up to date about all CDOC activities. Next, you will see a wonderful QR code here, and it will take you to what Shantae just mentioned as our CDOC State Cancer Plan Revision website. This is a fantastic website where you can stay up to date about where we are in the process. It also, if you don't want to complete the survey now, also has the link to the survey that I know Sheila put into chat as well. Thank you, Sheila. That we'd like to once again reiterate to complete by January 23rd. And we ask a few different questions, both sort of your opinion right now about what you'd like to see prioritized in the plan, also what you think about certain kinds of innovations in format, trying to make it a little bit more interactive. And also finally, if you are interested, how would you like to be involved? As you already know, all of us are crucial to the development of what will be now our future 10-year cancer plan. And so to ensure the most complete, robust, targeted, and relevant 10-year plan, we really value your involvement, expertise, and service to CDOC in this 5th iteration of our comprehensive cancer control plan. So please take the opportunity in the survey to indicate if you're interested at all in being part of this and what part of it most interests you. Thank you all so much for your time. And I know that we at CDOC look forward to collaborating with all of you in this wonderful, inclusive, transparent process. Back to you, Shantae, and our CDOC team, if we have a few minutes to take some questions. Thank you.
Thank you so much, Laura. And yes, we have time to take questions. So if anyone has a question, please take yourself off of mute or raise your hand. I know a lot of you are already familiar with this process because you've helped out a lot, but some folks are just joining us, or maybe just joining us for the first time. So ask away if there are any questions that we didn't make clear, or
I see Bill's hand was raised.
okay.
Yeah, there's an initiative at UCLA to explicitly transition cancer patients to a more wellness focus. And I'm thinking particularly of breast cancer survivors. And I heard nothing about how we help people continue to be, fully living cancer survivors by encouraging them to engage in activities that are not specifically cancer focused. And in as much as my colleagues at UCLA have determined that this has been a missing ingredient to increase quality of life among survivors, it seems like we should pay some attention to this transition from being somebody who had cancer diagnosed within the last 5 years to now being cancer-free. And now I don't want to give up my oncologist because I'm always worried it might come back. But at the same time, there's a whole life in front of me. What do I do?
Yeah, so Bill, you were breaking up a little bit, but I think I've got the gist of what you were saying. And for those of you who didn't hear, because I got a message that that it wasn't as clear, but Dr. McCarthy is really talking about really incorporating some messages that may not be cancer focused for those who have had a cancer diagnosis and maybe are living 5 years beyond or reaching that point, just to incorporate into some of the strategies that we could be putting out in the plan around healthy living, nutrition, and physical activity, et cetera. Did I say that right?
That sounded good to me. Thank you.
Okay, yeah. And just to respond, and I don't know if Sora, Allison, or anyone else has any interjection, but that's why we want you on the committee, Bill. And I think you have to be anyways. No, but yeah, absolutely. And I know we've been having this robust discussion through email, and I totally agree. And I think that as we move forward in developing that section, we can definitely look to doing that.
Great.
And Karen.
Hi, thank you for everything. To Bill's point, just about survivorship, and I'm gonna point out that the Surgeon General has now said that, loneliness is a crisis. And in fact, there are a lot of studies show that there is also some connection between survival and loneliness, also stress levels, and, possibly even a connection between like loneliness and developing all kinds of chronic conditions, including possibly cancer. So I just think that, when we consider how much effort we put into smoking cessation, and we know that loneliness is kind of equivalent to smoking a pack of cigarettes a day, that might be a focus, both kind of in preventing cancer, but also in helping survivors. We know that, I just was looking it up, like there is an association between having all kinds of symptoms post-treatment with loneliness. So that's something that we might want to consider. And then the other thing that I thought was really interesting that I learned about in the cancer committee at UCSF is that the cancer registry doesn't track recurrences 5 years out. And I think that is something really interesting, because actually that reflects on the quality of care. If somebody doesn't get, for example, the standard of care, they might be more likely to have a recurrence. And that's really difficult to track. And as we're looking at mortality rates, I think it's really interesting how difficult it is to track recurrences, and that there's no system in place. And that is something that I really think would be important to implement. The only reason we track recurrences is, hospital by hospital. It's not required nationally or statewide.
Thank you. Thank you for that, Karen. And I see a comment over from Anne here in the chat.
Hi, this is Ann. Yeah, those of us that are accredited by the College of Surgeons, the COC and NAPBC, we collect, we track our patients for life, and that's recurrences and treatments. And we document that and submit it to the state, whether they can collect that because they don't have the budget or the computer space to keep it, but we do. And we also submit it to the National Cancer Database on an annual basis. So somebody out there has the data. It is being collected by those of us that are accredited.
Thank you, Anne. Sarva.
Yeah, hi. First of all, I'm happy to see that childhood cancer made it to the part of the state plan. And my question was, how do we make sure the committee who will be discussing about that is kind of has different components in terms of like caregivers, different patient advocates, and all of different components that would need to really have a good plan in place. And following to that, and if we are interested, how do we get involved in those committee?
Yeah, so in terms of who is involved in developing content, we, put a call out to our coalition members and all of our partners. At being involved in 4 iterations, what generally happens is those who are already involved in the process make referrals out to different colleagues in other organizations or colleagues who have that particular expertise. And then it comes, through us to join the committee. And we will, as I said, once we determine what all of the committees are, people can submit their interest in participating, and it'll be a quick review by our committee, our Cancer Plan Advisory Committee, for those joining. But it's really going to be looking at, or it'll be up to, the folks that we have that will already have been volunteering. And if we don't have someone for that subject, for example, we'll reach out to our experts at our NCI designated cancer centers or other, other organizations that we know to get involved. And we have a really good list of those who want to participate for childhood cancer already, just FYI.
Thank you.
Any other question? Let's see, we have some in the chat here. Yes, I see from Dr. Ashing.
Hi, Shante. Hi, team. Happy New Year.
Happy New Year.
Yeah, I just wanted to echo Bill's comments. And so if there's a way we could prioritize, I know that's a strong word, healthy lifestyle and well-being for both prevention and survivorship, because I think that the data is very strong now, especially for exercise. So if we could include that. And then have a way to share resources that already exist, both within the state as well as nationally. So we're not, feeling like we have to create all of the material and content to direct people to get support in these areas.
Thank you.
And another idea following up on Anne, I really like the idea of trying to track who gets guideline concordant care. And I know that's a challenge, but maybe we could think of course, more work, a subcommittee or something, later on to think about that at a state level, for those of us who are, part of the, not NCCN, but those who have to track. And City of Hope is one of those cancer centers that need to track for our accreditation. So maybe it could be a small coalition of those cancer centers that track, because I think it's so important in terms of outcome. It's not just, you know, timely diagnosis and timely entry into care, but also the kind of surveillance that people get and the type of and treatment. And then those who get guideline concordant treatment, both at the time of first diagnosis as well as recurrence are, you know, so it could be a sub study or project later on. So yeah. So Anne, if you're interested, maybe sometime we could talk about that.
Absolutely. I think those facilities like yourself and ours, and we're just a community hospital, but we follow all the guidelines in NCCN, and we have tumor boards and blah, blah, blah. Anyway, there's a lot of, we have like 5 or 6 hospitals in Bakersfield, Kern County area, and we're the only one that's accredited. So guidelines aren't being followed necessarily in those other facilities. And so it's a concern. And we can talk about it later. Sorry. Thank you.
Great. Well, thank you for that discussion. And I see Karen also has left a comment related to that. So, and then I see Raquel's comment about perhaps focusing on the social determinants of health, just referring to seeing content on loneliness and social isolation. So yeah, I think, excuse me, I think that's, again, you know, our executive committee, we've been having discussions as of late related to healthy behaviors, healthy lifestyle, social determinants of health. So I think that's certainly going to make it in. All right, any other questions that anyone has? And all of this great feedback. I mean, we are obviously recording this and I'm taking notes as well. But please answer the survey and tell us on the survey as well. All right. Last call for any questions. I just want to make sure I'm not missing anyone here. All right. And like I said, you know, I know a lot of you have been involved with CDOC and have helped with this process before and kind of know a lot of this information, but for some, they're hearing this for the first time, and we're excited to get going, you know, on this iteration of this next iteration of the cancer plan. And one thing to note that we didn't mention that you'll see in the survey is, you know, we are looking to possibly have a 10-year cancer plan this time around, but you'll be able to comment and provide feedback on that as well. Thank you for your comments. Thank you for your participation. And as always, if you have questions, you can go to the CDOC website, or a lot of you guys have my email. Please let us know with any questions. And we'll look forward to working with you, hopefully on this plan over the next year or so. Thanks so much, everyone.